If you get to the point when everything chaps your ass the same, everything pisses you off, doesn't matter how big or small the problem is, if everything just totally pisses you off, you're having post-acute withdrawal usually. Okay, there's like, it doesn't matter if someone just looks at you cross-eyed or someone crashes your car. You have the same reaction. Okay, you're probably in post-acute withdrawal. Okay, so I had this, my sponsor made me put this list up on I have a recovery room in my house, okay? I have a little meditation place and a little table that I do my journaling every night and I do whatever. And so for the first 2 years, I had to have my post-acute withdrawal symptoms up on my recovery table. And I had little relapse checklist things and like how many, when we get into relapse process next week, we're gonna look at relapse. I had to like write down, did I have any post-acute withdrawal symptoms today? Okay, because if I can recognize them, there are some things I can do to help manage those. Okay, one thing is that safety card that like some of you have gotten that, some of you haven't yet. But that safety card can actually help you like calm your brain down. It can help you like get more oxygen to your brain right when you're having a craving or something else like that, okay, in the moment. And so, yeah, stick your face in cold water, take a cold shower. That's one of the things on the safety card, right? All right, so like that woman said, I don't want to put my face in cold water. I said, what's more uncomfortable, putting your face in cold water or standing in front of the judge again? She goes, okay, I'll try it, right? She came back the next week. She goes, that works, Chris. That works. I put my face in cold water because everybody was pissing me off, and you know what? It helped me calm down. I started thinking more clearly, okay? All right, so here's some things that you can do on the next page. If you recognize you're having post-acute withdrawal, stress management is the first thing. So know your triggers and avoid people, places, and things that are your triggers, especially during that time, right? Okay, I'm sponsoring another person right now who said to me, I've been sponsoring for a long time. He's got almost 18 months in, so he's got about 6 more months to go, right, before, but he was having really bad post-acute withdrawal last week, but he was supposed to go to his mother-in-law's house, who, he said, Chris, this is the woman who always gives you these backhanded compliments. You know what I mean? Like these digs and everything. She'll say things like, gosh, you don't look as fat as you normally do. Have you lost weight? You don't look as fat as you usually do. I mean, like, that's a compliment? And he said, Chris, I just sit there like this and I just go, I'm gonna kill you. I'm gonna kill you, I'm gonna kill you. Okay? And so he was like really having bad post-acute withdrawal. I mean, to the point that he has a job where he does welding. And I guess there's different kinds of welding, and there's some that's like really flammable. I mean, that's more dangerous than others. And he had to tell his boss that day that he couldn't do it because he could not remember the safety precautions. That's how bad his post-acute withdrawal was last week. Because he had to go back in front of the judge for his final hearing to get his last DUI removed as a felony. You know what I mean? Like you can petition sometimes to get, if you've had 2, to get the last one, if you've done all the things that you're supposed to do. So he was stressed out because he didn't know if he's going to get that off his record. So he had to tell his boss, I can't weld today because I can't remember how to like make sure that I don't blow shit up. That's what he said. So his boss said, okay, don't weld today, right? And he had to go home and he felt horrible and he lost money and all that kind of stuff. And then his wife said, oh, we got to go to Mom's house tonight. I said, don't go. Or if you go, have an escape plan. Right? Because he said, well, I usually carpool with my brother her brother and his wife. And I said, don't get stuck to where you can't get out. Have an escape plan. You're like, oh, okay. I said, and you know what, you don't have to go. Right? Okay. A balanced diet. People especially who are alcoholic tend to be hypoglycemic, which means that our blood sugar drops faster than other people's do. So if we skip meals, we get really bitchy and cranky. Yeah. And we feel awful. You know, my sister used to tell me you're going to eat in a few minutes, just get over it. I say, get the flu and feel better. You know, like that. As soon as I eat, I'm fine, okay? My blood sugar starts getting back up. But I'm hypoglycemic. If I eat something every 3 hours, I eat small meals all during the day. Because if I don't and my blood sugar drops down, man, my head hurts. I feel just my skin is crawling and I'm just like, yeah, I can't function. And I'm like totally irrational and emotional. You know, I could just call it grumpy. I get really, really grumpy, okay? And that's when people around me go, oh, you need to eat. When's the last time you ate? They know me now, right? I go, oh, yeah, it's been a while. I better go eat something. So a balanced diet's really important. When you're having post-acute withdrawal really bad, it says avoid excessive sugar and caffeine. If you already drink a lot of coffee, don't quit then. But just don't drink more of that, because usually what happens during this time, people smoke more and they drink more because your pleasure center is really active, right? And so they start drinking and smoking more than they normally do. And it just makes your pleasure center like get bigger. Okay? They've actually done a study that most people aren't really willing to do this, but people who quit smoking the first year of recovery have an 80% they relapse 80% less of the time than people who don't quit smoking. Because when you smoke, nicotine, 1,500%, right, makes it the post-acute withdrawal process longer from your primary drug of choice. So, you know, most people that smoke go, don't talk to me about, I'm not listening to that right now, whatever. Nicotine is one of the hardest drugs in the world to quit. You know, that was harder for me than meth. Seriously, man, I was like, I had to give up everything. It was hard. It was really hard. But it's only 7 to 10 days. It's 7 to 10 days physical withdrawal. Physical withdrawal.
That's for any drug?
No, for nicotine.
For nicotine.
7 to 10 days is what?
Physical withdrawal from nicotine. The initial physical withdrawal, okay? The post-acute withdrawal, though, is big because now you're not feeding it anymore, right? So nicotine for me was my last drug. It was my last dash. Right? I don't like coffee that much.
I have a question. I'm currently taking Ativan, okay? And it's been an up and down thing with me with doctors and benzodiazepines.
Right.
I've had doctors take me off of Ativan, and then without me even asking, they sometimes would call me and say, look, we think we made a mistake taking you off the Ativan. We think the other medications that we're giving you are not doing the job. This was maybe 2 months.
Right.
And they said, we're going to start you back on it, but we want to know exactly what's going on. We want you to come in and see us every 2 weeks. Tell us what's going on. There seems to be some ambivalence here, and maybe it's because I'm really screwed up. I mean, I get panic attacks. I don't think it's PTSD. I think
Yeah, and panic attacks.
I don't think they know what to do, and I'm trying
Yeah.
to give them honest answers, okay? I've told them, look, I'll abuse medication if I get the chance. I'll drink on it if I
Right.
get the chance. So they know my history.
Right.
But I think they're afraid that if I don't take it, the other medication is not going to keep me from going into severe panic attacks, which have happened to me.
Right.
Well,
And
think
I believe panic. Somebody once said, like they said, Chris, my husband tells me that my panic attacks are all in my head. And I go, you know what? Anything can trigger a panic attack. But I said, it's real in your body, right?
well, it feels to me like I'm going to die of a
Yeah,
heart attack
yeah.
or something. It's not-
And it's real. Your blood pressure, respiration, all that stuff goes up. So I always say, you know what? Some people have to have PRN or as needed Ativan, you know, things like that. They have to have that. And it all comes down to motivation and do you have a monitor and a schedule?
Right.
So, you know, the one guy that I'm working with, he's also, he's got severe PTSD. He was in the first Gulf War, okay? And he had like severe PTSD. And the guy that, you know, is doing the welding and everything, he's got PR or as needed Ativan as well. But he has somebody hold it for him and then has to go to them when he needs it. But he's able to do that now. It took him 18 months. Okay, so he said, you know what, Chris, I can't handle, it's kind of like cocaine addicts, their first year. Like for me, my first year, I couldn't handle money, right? It's a trigger. I couldn't handle money. I had my sponsor we didn't have ATM cards back then, right? We had checks, right? You had to write checks. You actually had to go to the bank and write a check and do whatever. And he said to me, he goes, wow. He says, you get money? And I said, Bill, I need help. I can't have more than $10 in my pocket. I'm going to be going out and buying something. I'll negotiate something with $10 or 15, you know, whatever. But he said, yeah. So for the first year recovery, every time I go out on a Friday, he goes, how much money do you need? I said, $20. He goes, why? What are you doing? And I said, well, I'm going to a movie, and then we're probably going to go out and get something to eat afterwards, you know. And he goes, now this is 85, right? He says, well, movie's only $5. Okay. Movie's only $5, and he says, what are you going to get afterwards? And I said, we'll probably get, you know, like a hot dog on the street or something. He goes, okay, $2. And he goes, that's $7. What else do you need? I said, well, Subway money. He goes, okay, that's another $2. He goes, I'll give you $9. And I'm like, oh, what's my money? And he says, yeah, but you know what? It's a trigger for you. And I didn't like it, but he was my monitor, right? Everybody has different triggers. And if you need medication, it can be a trigger, but it's, you know, it all comes down to motivation. So some people have chronic pain and they have to take opiates.
I still think they want to wean me off of it, but I think they're afraid that what they were doing was trying to find a substitute in a hurry for it.
Yeah, yeah.
I reached the point where I could get 2 hours of sleep a night.
Yeah, well, what are doctors trained to do?
I don't know.
Write scripts. Doctors are trained to write scripts. They'd rather write a script for you and get you out of their office, okay? Then how many doctors sit down and really talk with you for a long time? Even your psychiatrists. A lot of them don't, though. But a lot of them don't. Even psychiatrists will just say like 10 minutes with you, then you're out the door. Okay? They're not that, you know, what do they say, become your own physician?
Yeah, even my Suboxone doctor seems a little too free with writing scripts out.
Mm-hmm.
I tried to tell him yesterday I want to, you know, either go down and get off. But, you know, I mean, I've only been on for a couple of weeks, so he
Yeah.
said that he wants to, he said things are going good right now. He wants to wait and doesn't want to see where we're at. But it just to me seemed like he's just too willing, too free.
Yeah. What's that old saying that if you,
I really thought if I tried, I could probably got more off him.
yeah. Well, you know that old saying that if the only tool you have in your toolbox is a hammer, everything looks like a nail, right? Like surgeons, like, let's operate. I go, can I try chiropractor first for my back? Let me try something holistic or a little more natural, you know, like, can I get some massage therapy? Can I get some physical therapy? Like, why do you want to cut me right away, right? Okay, so but that's how they're trained. So take the best, leave the rest. That's what I say with doctors. Take the best. I've worked in community mental health centers for a long time, and I know this is kind of like, maybe not so nice, but I always think psychiatrists are sometimes more screwed up than their patients. A lot of them. I go, God, these are not healthy people. Oh, what is going on with these psychiatrists? And so I tell my clients sometimes, I say, look at your psychiatrist as a script pad. They're a script pad to help you get the drugs that you need, and we need to be like, all we need to figure out as your therapist to me is like, is it working or not? If it's not, then I can be your advocate and go with you to your psychiatrist and say, I don't think this is working because he's not feeling better. Let's try something different, right? And psychiatrists are like, who you are like that. And I said, okay, listen, I'm his advocate. It's not working. Are you hearing what we're saying? Okay, because sometimes we go into a doctor's office and just go, okay, whatever you say. Okay, we all get trained that way, right? Okay, all right. People who take extra vitamins, especially B vitamins, B and C help the brain heal. People who have vitamin B deficiency, they get a lot of neurological damage in their brain and everything. Okay, so if you take a vitamin B supplement, like extra, like complete B supplement complex, plus extra vitamin C, your body and your brain can heal faster. Okay, so these are all things you can do to manage to make it heal faster.